welcome. Thank you for coming. You are coming from Canada for this Rezūm procedure.
Welcome.
You are, what's your age?
I'm 53.
53 now. So usually we were previously operating BPH, benign prostatic hyperplasia, at age 65 in average. But nowadays people understand this situation is very difficult and affecting the quality of life, and it starts around 50s.
Yes.
What's your symptoms? What are your complaints, and when it happened?
So, couple things. There's a lot of burning sensation.
Yeah.
And all the time. Also, I have a urgency to go all the time. So not only at night, even during the day too. Like when I go very fast, it's not a lot. It's only just a little bit. Maybe it's weak. So sometimes it dribbles. They're dribbling. Yeah.
So the stream, quality of the stream.
It's it's not that good. It's not like
compared to your
when I was
younger ages, it's different now. So the urine volume, the urine pressure is decreased.
Yeah, decreased.
And burning sensation, and you feel it's not empty.
It's not empty. I have some pain there too. I'm not sure the size of the prostate. Maybe I don't know. We'll check it out.
Yeah, we will see it now. But did you ever go to doctors in Canada?
Yes, I have many doctors. I have 10.
For example, 10, 5?
More than 10. I just like 15 different doctors for the past 10 years.
Yeah.
None of them could help.
What's the diagnosis over there?
They see you and they say, okay, try this medication. The first line of defense, always medication. Antibiotics, take this. Try it. If it doesn't work, take another one. Try it. It doesn't work.
So they also think there is some inflammation, some prostatitis issue. They try to treat that?
Yes, but they use medication first line before anything.
Did you have cystoscopy?
Yes, I have.
Because when there is burning sensation, we are always have to think about cancer issues, carcinoma in situ issues, because only, of course, the main reason, maybe 95%, it is prostatitis, inflammation, but also it's possible to have some malignant diseases.
Yes.
So they did the cystoscopy once or
they did it twice,
twice,
and they couldn't see any kind of cancer. That's
Yeah.
good news.
Yeah.
But what they said is very tight. I don't understand what that means. Very tight, meaning probably inflammation or
The prostate is tight or
Yes.
bladder? What did they say?
the prostate is tight.
Prostate. So there is usually there may be some obstruction in the bladder neck. We call it bladder neck obstruction. And it's very difficult to push the instruments inside. Do you know, did they use these rigid instruments or flexible ones?
Flexible.
Okay, it's done in the office, right?
No, the hospital actually.
Hospital?
Yeah.
And I mean, were you having anesthesia, sleeping, or
I was no, they gave me anesthesia there. They made me pain
just in the local?
in the area, in the genital.
Yeah, was it painful?
Very painful. It is. At least I was not painful, very painful.
Yeah.
And
Yeah. Oh, sometimes.
but they looked very like in seconds. They didn't take their time.
Yeah.
They don't stay there long. They just like, oh, nothing, pull up.
How long did they put the anesthesia? How long they wait?
Probably a minute.
This is the problem. I have an uncle in Boston. He's a urologist. And when I first see him doing office cystoscopy, local anesthesia, I said, oh, it's painful. How do you do that? He said, when I put the local anesthesia, this jelly, I wait 20 minutes, maybe 30 minutes.
Wow.
I said, oh, okay, that makes sense. And nowadays, I'm also doing sometimes, if it is needed, for example, if there is bleeding in the urine, you have to do cystoscopy.
True.
And to do it with general anesthesia, it is time taking and too much problem for the patient and too much costly. So when I put the local anesthesia and wait for 30 minutes, it's numb.
Okay.
It really works.
It's better, it's better like this, because I don't know, they take too fast, and when you look too fast, you can't see things because you can't tell. And when they come out, they did twice. I'm not saying once, twice. Two different doctors.
Yeah.
So not the same doctor, so two different words. And they both said it's tight. I don't know what that means.
So when you have difficulty in pushing the instrument inside, there must be some stiffness in the prostate.
Is it urethra or prostate?
Usually in the prostate.
Okay.
If it is in urethra, it is visible. You can see it.
Yeah.
Okay, then you had many therapies and it didn't work.
Yeah.
And then you heard this Rezūm procedure and our technique. We previously try to drain the inflammation inside the prostate. We do it by putting one finger from the rectum and squeezing the prostate, at the same time looking with the camera if prostate is drained, is the inflammatory fluid is coming out. Because I know in some people there is a benign prostatic hyperplasia plus additional inflammation, prostatitis. So if we give the hot steam, boiling steam, to the fluid inside, if there is too much fluid, it will melt. It will absorb the heat, and it will not affect the tissues.
Right. I like your style. That's why, because from many videos I watch, from many YouTubers, many doctors I follow too. I read a lot about it, and sometimes I do like 2-3 times repeat, because they're like about 6 minutes long, maybe 10 minutes long. I go through it and I read every part of it and the technique. So your technique and your style was on top. It was amazing, and so I came all the way from Canada just to.
Yeah, because I always deal with these prostatitis patients in younger ages. For example, 30-35 year of age. It's 100% prostatitis if patient has some symptoms. But in our age group, like 50s to 60s, it may be prostatitis plus BPH. After 60, prostate becomes too big and squeezes the inflammatory tissues, and prostatitis go away.
Oh, okay, yeah.
Because it's got enlarged, and the tissues, that the inflamed tissues, they squeeze, and the patient says at around 60s, oh, inflammation has gone, burning sensation has gone. 2 years later, he can urinate. He can't urinate because this enlarged tissue this time squeezes the urethra. So what I do to the patients around 50s to 60s, I just drain the prostate before the procedure. When you are asleep, when you are under anesthesia, there's no pain, it's easier. So I try to drain the prostate, then give the Rezūm. The results are, it's very new. I mean, we are not doing it for a long time. It's only 1 year we have experience, but the early results are extremely good. Yeah, people say I am urinating like in high school. They are happy. Of course, there are some extreme cases. For example, the last guy coming from Canada, 140 grams.
Big, I saw the video. Yes. Yeah.
And he's happy. He's saying he's doing good.
It's very good. I think the technique you're doing, the style of the Rezūm, helped, because the steam, you give it about 9 seconds to something like that. How many shots? Depends on the size.
Actually, yes. We measure the length of the prostate, and for each centimeter we give one to right side, one to left side. Usually it is around 2 to 3 centimeters, sometimes 4 centimeters, the length of the prostate. So we give accordingly, and the machine only lets us give 15 shots. It never works again. This guy never works again in a second patient. So the companies nowadays want to sell the machine first, then in every patient they want to sell this. So this will be shot only 15 times. For this 140 grams, I've shot all of them. 15 shots.
All of them.
Yes.
Wow.
And usually for your case, if it is a 50-gram prostate, maybe 3 to right, 3 to left, and 1 in the middle, 7 shots will be enough. We will calculate it inside the procedure. Now, let's see your prostate with ultrasound and measure its volume. Come. Okay, now I'm looking to your prostate. The bladder is empty, the bladder walls is kind of a little thick, but it's normal when it is empty, that wall is thicker. Of course, we will see inside the bladder if there is any abnormality. And here, the prostate volume is not huge. I will measure it.
Yeah, it's not huge. They told me in Toronto, yeah.
So we measure 3 dimensions.
There's a good picture to make size, or do you want more pictures?
I will look more.
Yeah.
So it's 26.
Oh, really?
So, yeah, but I think it looks around 30.
Yeah, the doctors, they told me around 40. Remember, I did 40 plus and 40 grams. They said grams. And
Sometimes it may be more swollen when there's
yeah,
inflammation
you're
inside
right.
the
You're
prostate.
right, you're right. Yes.
And I can see a calcification inside the prostate.
Yes, there's calcification and.
This is because of inflammation. Previous inflammations, prostatitis attacks, when they heal, they leave the calcification behind in some patients, not
There's,
all of
yes,
them.
there's calcification. Yeah, they told me that too.
So the Rezūm procedure is always for treating the urine flow rate.
Okay.
The main aim, because it may reach to this calcification area and treat it, question mark,
Yeah.
or maybe it will not reach. Its aim is to open the urethra.
Okay.
Urethra is a channel like this.
Yeah.
Görüyor musun? It's a channel like this,
Okay.
and it is squeezed by the prostate. Now we will go inside and shut the steam, and we are trying to make this urethra wider.
Okay.
This is the main aim for this Rezūm procedure. Sometimes people ask me, I have prostatitis, can Rezūm treat it? This is not a guarantee. If the prostate is larger, for example, think about this as a prostate, this part. I make the urethra larger, maybe it will not reach to this
True.
peripheric part, lateral part, and the inflammation in that part will not heal.
True.
So the treatment for inflammation I will do in the procedure is emptying, draining the prostate. But if the patient is not urinating normally, properly, so he's always prone to get new infections again and again,
All the
again
time,
and
yes,
again.
Yeah, yeah.
So our aim in the operation tomorrow is to make urine channel larger and to make you void better, urine better.
Yeah. Will that help with the Rezūm with the steam? Maybe they kill the infection if there's infection.
I'm sure it
Yeah.
will
Yeah.
if it can reach that part.
Yeah.
Because we are, as I said, from this
Yeah.
urethra entering 1 centimeter inside,
Okay.
and we will give the steam.
Yeah.
In these regions, if there is inflammation, it will kill them.
Yeah.
But if this inflammatory part is a little far away, maybe it will not reach to this
okay,
part.
yeah, possibly. Yeah, yeah.
So the main aim, of course, is to make you urinate better. So this is the main aim of the procedure. But usually it helps all of them. In our age group, in your age group, prostate is always a problem.
Yeah.
So opening the channel, making urine more easily, better, and without pain, it's always helpful. So I am also looking to your kidneys.
Yeah, the stones maybe anything like that.
Take a deep breath and hold it inside. Your liver is a little fatty, not too much. We can say it grade 1. And the kidney. Of course, I am not a radiologist, and this is not a official. Okay, there are some little tiny stone particles. Maybe take a normal breath. So these are little tiny, maybe crystals. Not, I can't say it's a stone.
Yeah,
But
they
there
said
may
that's
be-
small, yeah, but I didn't know,
Yeah.
they didn't do nothing about it. They had this one here.
Yeah.
Nothing.
And the color of the liver is a little brighter than the kidney. That means there may be a little fatty change in
Yeah,
the
I have
liver.
some they're saying about liver enzyme or something like that.
Yeah, these fats in the cholesterol and
Yeah.
triglycerides
Because-
affects this.
Because the reason was, because of this suffering and interrupting my life,
Yeah.
I take my anger on food. I eat a lot.
Yeah.
Kebab,
You can cook
I've done a kebab.
it's always in after some age we always find some reason to eat more.
Yeah, no, I'm talking about the stress when I'm stressed because I gained weight.
Yeah.
I wasn't like this. I was like 180.
Yeah.
Now I'm 240.
Yeah, and your varicocele. You mentioned that you have varicocele, and it affects your testicle and affects your testosterone.
The hormones.
Yeah, hormones too. So it may also have some effect. We will also think about it.
Yeah.
Turn towards me.
George, yeah.
And we are searching for the left kidney. Okay, this is left kidney. It looks normal in size. There is no cyst, no mass. There may be a cyst. Take a deep breath again. No, this is not a cyst. And I'm looking for the stones, but as I said, I am not a radiologist, and this is not the best device, but it's a good resolution
interest,
device.
yeah. So you'll see things, if not there.
Okay, I saw your prostate. It's not a huge prostate. Sometimes I'm sure it was bigger previously when they measured it's 40 grams. Now it is around 30, 26 I measured. Sometimes I can measure 32. Okay, so it's a middle size prostate. It's in your age group it's normal to have this size, but you are having difficulty, you are having problem. Tomorrow we will see inside and we will give steam and your urine channel will open. I will drain the prostate inflammation. If prostate inflammation in that size of prostate, I am expecting the steam to go everywhere.
Good.
So
Yes.
if it was a 90-gram prostate, yeah, it will not penetrate to each part of the prostate. But in your prostate size, I am expecting it to reach every part and solve the inflammation problem too. So we say the best part of the Rezūm is it has no side effects.
Yes, that's good. That's very important.
That's the very important part. And because this is a tiny instrument, we don't need to dilate the urethra. It goes in very easily. And when we give the steam is distributed inside the prostate. It doesn't go out of the prostate because there is a capsula.
Yes.
And outside the prostate, just next to it, there are nerve tissues going into penis. In the other procedures, if we do some mistake, we can harm these nerve tissues. But here, there is no chance.
Low side effects, very
no
good.
side effect. And the sphincter is the most important part. Leaking urine after a procedure is the most important side effect of the procedures. And in holmium laser, this is a big issue.
Holmium and TURP too.
Yeah, both of them. Especially in holmium, we are always in the congress. We argue or we discuss how we can get rid of this leakage.
This is difficult, very difficult.
Yes, very difficult. And the leakage usually stops maybe in 6 months after HOLEP procedure, but it's difficult. It's not nice to have leakage, urine leakage for 6 months. So in this procedure, there is no risk. There may be a very little percentage of risk of retrograde ejaculation for you because
it's smaller, not too big.
Yes.
Yeah,
there's a good prostate like.
But does it last forever? How long?
When this is very long, very big, and we widen the urethra, it will not be widened too much, and the sperm coming out from the bottom of the prostate will go out. It will not go inside the bladder because the prostate tissues will squeeze. But in your prostate, when it is very small, and I want to give the steam as much as possible to shrink the prostate. If I shrink the prostate too much,
too small becomes.
It becomes too small, and the channel widely opens, and the sperm. There's a risk of sperm to go up to the bladder.
I tell you what, there is a risk with that. For the alpha blocker, remember they give you for that for the older age.
It does the same.
It does the same.
It opens the channel
too much,
and
because
the
sperm. There was nothing.
We call it dry ejaculation.
I stopped those medications because they're.
So people always choose Rezūm to get rid of this risk. They don't want that risk, but you, with a very small prostate, have such a risk. What can we do? We can. The company says, if the prostate is small, give less. They say less is more.
True. I agree with you. Yes.
So if I give less, the risk of this retrograde ejaculation decreases from maybe 3% to 1%.
Yes.
And but the risk of the prostate inflammation staying inside will be a little higher.
Because less steam, right?
So we have to make a decision tomorrow. We will talk again tonight. I want you to think about it. For the inflammatory part, giving more steam is better. For the retrograde ejaculation part,
do what's best. We're gonna decide.
We will decide and make a decision throughout the operation. If I see the obstructed prostate tissues, yeah, it's easier to shrink these parts. Sometimes we see only bladder neck obstruction.
Yeah, but you saw the wall that's a little thicker, maybe on the bladder there area.
Yeah, we will see all of them.
Yeah,
I will record. I will share with everyone. I will share with you.
Thank you.
Okay, so thank you for coming.
Thank you. But one more question. What about the varicocele?
Yeah, varicocele tonight. I think there is an indication for your varicocele too.
Okay.
Because normally when fertility issues finish,
oh, I have 2 kids. Everything okay.
we don't care about this varicocele, but you have huge veins and your desire, sexual desire, such things are important. So you have the indication. I want you to decide tonight if you have such a concern in your desire, sexual life, testosterone levels.
What's the side effect? What's
side effect for varicocele? It just makes the healing a little longer.
Yeah.
Maybe 1 week of swelling in this testicular area, but people come for varicocele surgery and they come and go back in 1 week.
Yeah.
So it's same for the Rezūm too. Maybe if we do 2 of them together, it will be a little more difficult for the healing, but these are not big
2.
issues.
But what if just 1 on the last
Yeah,
side? Maybe.
I think it will increase the problems, the conditions in the healing, maybe 20%. So you will doing a double operation, 2 times operation is not a good idea. But if you want to get rid of the varicocele, it's better to be done in this session.
Yeah.
Because Rezūm is very easy. The problem with the Rezūm is waiting 1 week with the catheter.
Yeah, that's the problem, because catheter you have to put the tubes, right? And you have to pee in it.
Yeah, there are 2. You can use a plug and unplug it and empty it, put the plug again.
Yeah.
But usually people prefer to keep the bag and to empty it continuously. We will see after the procedure, according to your needs. We will.
Awesome.
Yeah.
I thank you. I'm really trusting
Thank
you.
you.
I came all the way from Canada just to see you and
coming.
your system
Thank you.
technique.
Yeah.
I'm looking forward to it, honestly. I can't wait.
Yeah.
And hopefully it turns out good.
Yeah. Today I will send you for preparations to leave hospital.
Yes.
And
Okay. I'll go
tomorrow we will do. Thank you for coming.
Thank you very much.
Thank you.